Center in Willows is teaming up with UC Davis Medical Center to respond to a major infectious disease affecting, I think, what, 1 in 30 baby boomers.
Yes,
it's hepatitis C. And Amy McKelly is Chief Operations Officer at the hospital and joins us with details. Thanks for being with us today.
Thank you for inviting me today.
Hep C, I mean, a lot of us hear about it, but I was unaware that it is so prevalent. Who's at risk?
Well, they're currently saying really any baby boomers, so people born between the years of 1945 to 65 are at the highest risk, any Vietnam-era veterans, and a lot of that is just because we didn't test back at that time.
Why is it so important to be tested?
Well, it's very important because hepatitis C is a virus that initially may cause some mild symptoms, some flu-like symptoms, nausea, not feeling well for a couple weeks, but then after that goes away, it lays dormant in your body. It can lay dormant in your body and not realize that it's there for many years until you are a little bit older and maybe have another health concern. As soon as your body starts to fight something else, that hepatitis C comes out and can cause some real problems.
And so let's talk about what's new at Glenn Medical. You guys have teamed up with the UC Davis.
Yes, ma'am. So over at Glenn Medical Center, we are bringing a lot of different specialties to our rural health areas that didn't have access to those specialties before, and one of them is this hepatitis C treatment program. So UC Davis and UC San Francisco have a grant-funded program to reach out to rural areas like ours. We use telemedicine support, and they're able to help us choose what treatment is best for our patients and to help them get financial assistance if their insurance doesn't pay.
Because there is treatment, but some of it's quite astronomical, and that's where this help comes in, I think, really important.
There has been treatment available for a while, but the treatment was very similar to chemotherapy. Oftentimes the treatment made people feel worse than the disease, and because of that it had a very high failure rate. Now the treatment's very simple. It's a pill every day for 12 weeks, and it has a 95% cure rate.
That's encouraging. Again, still hoping the prices come down more, but it's no reason to put off getting tested, because then you can at least start to plan, you know, what's the best for you and your options.
Absolutely. And all of the pharmaceutical companies do have financial assistance available, and so if the patient's insurance doesn't pay, we're able to find assistance to get it paid for.
Okay. First things first, people need to call and just make an appointment, right?
Yes, what we would really like to see is, and there's a lot of commercials that we see now about hepatitis C, we would like to see everybody get treated or at least tested through their primary care doctor's office. Just a hepatitis panel done. If it comes back positive for hepatitis C, then they refer over to us at Glenn Medical Center, and we will work with UC Davis to get the rest of the testing done.
All right, some good information. Thank you so much for coming on the show.
Thank you for inviting me today.
We'll be back with more in just a moment.